Hello, I'm Christopher Michaud. I'm the Director of Public Health for the town of Dartmouth. I'm joined here today by Callie Nunez.
Hi, I'm Callie Nunez. I'm a senior nursing student at UMass Dartmouth, and I started a chapter of Young People in Recovery on campus in March.
And we're here today to talk about an important event that was held this past fall in Dartmouth for the first time at the University of Massachusetts, Dartmouth. And Callie helped, she was the catalyst that made this all happen that, wasn't ever offered before, and I think it was an important event, and, I worked, with Callie to bring this, and it was a recovery walk for a local chapter, a new chapter called YPR. YPR is Young People in Recovery.
Yep.
And is Young People in Recovery an area organization? Can you tell us a little bit about that?
Yeah, so Young People in Recovery, it's a national organization. There's 80 chapters across America, and we're actually one of the first that's strictly on a college campus. So what we do is we focus on education, employment, and housing. We're really just supporting students that are impacted by the opioid epidemic.
Great, and I understand that, because of your efforts with the YPR-MA Dartmouth chapter, that you've been recognized for that?
Yeah, so we've been in a couple newspapers and stuff, and a lot of community support, which is taking us a long way.
Yeah.
So.
And you also got the Breakout chapter award?
Yeah, so we went to the National Leadership Conference in August, and we won the Breakout Chapter of the Year. So of all the chapters that started up in the last year, we're the ones that they said were the rising stars to continue to watch out for. So.
Great. Well, I first met Callie because Callie was nice enough to speak at a COPE event back in March. COPE is the town of Dartmouth's movement to bring awareness to substance use. So COPE is an acronym, Community Offering Prevention and Education. Since that time, we've worked together. Callie's joined us at COPE meetings, and then offering her expertise from being on campus. It's important because the University of Mass Dartmouth is a town within a town. There's as many as 10,000 people there in some given days, and that's the population of some of our smaller communities just to the east of us. Right. So it's important that we remain connected with the university, and having that YPR chapter at the university is really good because it serves the students. And this event that you had, the walk, can you tell us a little bit about the walk? What did the attendees get from the walk that day? Was there anything there that was offered for them?
Yeah, so we had about 20 organizations come, and they provided resources at tables and from all different parts of Massachusetts, really. We had yoga from people in Boston. We actually had somebody come from Wisconsin that did the headbands and beanies that she sold, which people really enjoyed those. So, and we did a Delve release at the beginning, and a lot of people after the event followed up saying that that was really their favorite part, which was awesome because we're helping so many people, not just students but community members too. So
yeah, no, and it was a tremendous event because I have been involved with planning a few events, and and I go to different events in other communities, and it just seems like with a very busy society that we have today that it's difficult to get people to come, and there seems to be a realistic expectation as to how many people you can draw, and I estimate that you had about 200 people there, which is, I would say, the largest that we've been able to draw to date. So it was a tremendous success because we just haven't been able to pull that yet, and you did it. It was also possible through a collaboration with the Massachusetts District Attorney's Office.
Yeah.
April Cabrera helping us out with that, and coinciding with the Family Fun Day at the university. And with the event, you also had the resource tables. There were a variety of resources there, one of which was Healthy Dartmouth COPE, and we conducted surveys, and it was great because we got data back from the community, and it wasn't just Dartmouth-specific data.
Right.
We got regional data. And that information has already been brought back, and we're starting to look at it to identify where we need to go next.
Right.
And those efforts are underway. Also, I know that there was an organization there providing Narcan training.
Yeah, that was a big turnout. I think they were able to train about 25 people. So that was awesome, a lot of which were students. But we also are starting Narcan trainings on campus, and next semester the senior nursing students will be Narcan trained.
Great. Yeah, no, a lot of people, Narcan is still new, and it's not very well understood. I look at Narcan as, like an AED in a building. Anyone can need Narcan for, you can be prescribed an opioid, and you can be on it long term and forget that there is a warning on the vial that says do not mix with alcohol.
Right.
And from everything we're told, that those two that in combination is a good recipe for an overdose.
Yeah.
It's a tool to save lives, and getting those 25 people trained was huge. We've heard some very moving stories about people being saved because of Narcan training that weren't ordinarily first responders. So that was great.
Yeah, that was a big success. So.
Yeah, and then the walk itself. Tell me a little bit about like the actual walk and what it signified.
So we did 12 laps around the track, which was about 3 miles, but each lap was for the 12 steps of recovery that AA uses. So people were really into that, and really didn't want to stop before that.
Yep.
So that was really cool to get people to hit a target number, but also, 3 miles, it's a pretty good walk.
Yeah, yeah.
So that was pretty much the significance of the walk. But
Okay. That was, spaced out through the day. When I was there, I saw people walking the track the whole time, and I noticed that there were a few speakers during the event.
Yeah, so we had speakers come. One of them was a professor at UMass that lost his son to a heroin overdose like 20 years ago. So
Dr. Waxler.
Dr. Waxler. So
Yes.
that was great. And then we had Sean Flynn speak, and he's a person in long-term recovery. So it was good to get perspective on that. We also had like great music by Seth Newton from
Yes.
New England Musicians for Heroin Awareness. So that was awesome. That was his actual first event too, so that was nice.
Great. What do you see for the future?
Just getting more students involved. Right now we're doing a fundraiser for holiday baskets to donate to sober living homes in a couple in Fall River, a couple in New Bedford. So we'll have those out in the next few weeks, and then hopefully do something similar to the walk, but just surrounded by yoga, because I think a lot of people were really into that. So probably sometime in the next few months we'll have a big day of yoga at UMass. So
Great. Another walk for next year?
I'm hoping, yeah. I won't be there, but I'm willing to help plan it and stuff. And we do have a couple of students that want to take it over. So
Good. Excellent.
My name's Jen Cabral. I'm the youth advocate for the town of Dartmouth, and we're here at UMass Dartmouth today to support Callie Nunez, who's a senior who has organized this event. She's created the Young People in Recovery program, and she's done a great job. And so the town of Dartmouth, myself and Chris Michaud from the Board of Health are out here just to support her. We're really hoping to bring awareness to what addiction does to families, as well as the fact that there is hope, and that's what we're here today, is just to try to let everybody know that there is hope for anybody who's struggling.
Hi, my name is Linda, and I'm here representing Learn to Cope, which is a peer-led family support network with 25 chapters statewide. Learn to Cope was founded by Joanne Peterson when she was in crisis with a family member, and today the organization reaches out to over 5,000 members nationwide and all of the members that attend our 25 chapters. We have recovery speakers that come in to help our families gain insight as to what their loved ones are experiencing, and we provide support, resources, and knowledge for all family members that are in crisis with their loved ones.
Hi, my name is Callie Ladd. I'm here representing the Samaritans. We are a toll-free suicide and crisis hotline, serving those locally in Bristol County as well as all over the world. We triage for the national hotline. So we don't just service those who are feeling suicidal. We really help anyone, whether you're feeling lonely, depressed, or just having a bad day. We're there to talk. We're a completely anonymous and confidential service.
Hi, I'm Christina.
I'm Deasia.
We're here with Pure Health. We're a school-based organization that focuses on safe drugs, alcohol use, and safe sex and stress. And we are here today to represent our
It's Okay Not to Drink campaign,
which we do with our students who don't have to. We're saying that we're in an environment where it's okay not to drink, and you can check your blood alcohol content level and be safe.
Just really wanted to thank the event organizers for having members of the Dartmouth Police Department at the event today. It's really important that the community stays involved as far as bringing awareness to the epidemic, if you will, as far as heroin overdoses are concerned. The police department is very proactive, as well as the town of Dartmouth, in bringing awareness to what's currently going on and seeing what role we can play as far as hopefully bringing an end to this at some point in time.
Hi, my name is Laurie Gonzalez. This is my son, Corey Palazzi, and my husband, Dave. We started a nonprofit called Corey's Cause in 2016. It's our first year of our nonprofit. Our son, Corey, was a varsity athlete and a National Honor Society student at Taunton High who was accepted and enrolled into the nursing program at UMass Dartmouth. And he lived here on campus at UMass as a nursing major. He had shoulder surgery, which required pain meds, and he unfortunately became addicted to his pain meds, and eventually went to heroin and overdosed on heroin in 2013. And he suffered an anoxic brain injury. Pretty much what that is he went without oxygen for a short time, and he suffered some brain damage due to his lack of oxygen. So now what we do with Corey's Cause is we go out and we speak at community forums and at schools to share our story, just in the hopes that we can bring more awareness and help end the stigma, and just let people know that this does happen to any family. This disease doesn't discriminate, and it can happen to anyone. And we just hope by sharing our story that we can help someone else not endure what we've gone through.